What pectus refers to is a wide variety of chest wall defects that can occur. And it can be anything from a sunken chest, which we call Pectus Excavatum. It's actually relatively common. It occurs much more frequently in boys as compared to girls, but occurs in both sexes, probably 4 to 1 boys to girls. A pectus may be present at birth, or it may come on, be noticed in adolescence, or it may be something that was a relatively minor thing that you noticed as a parent when they were younger, and it's something that typically occurs when they go through a big growth spurt. And then you have a marked deepening of the chest. Symptoms are shortness of breath with exertion, and I've heard the story a lot of times of their child who previously was very active in, let's say, running, and then they start dropping off various things because they just can't keep up as well as they used to. And it's very common for them to get more short of breath as compared to their peers. Sometimes they can have chest pain with exertion and things like that. Generally, not everybody needs to have it repaired, but people who consider repair are those who have symptoms with exertion. The 2 main ways to fix it, traditionally it was called the Ravitch procedure, which was an incision across the chest and resection of some of the cartilage of the ribs and breaking of the breastbone. But that's been pretty much replaced for most people with what's called the Nuss procedure. And it involves putting a camera inside of a chest and then tunneling across the chest and from the right side to the left, and then we take surgical steel bars that we bend to the shape we want the chest to be, pass it across the chest through the passageway we make, and flip it over, and just much like braces on your teeth, you leave the bar in place for the body to remodel itself, and those bars come out 2 to 3 years later. Usually by 3 months they're back to full activity and not taking any medicines. You know, usually we have a certain protocol we use to treat the pain that we've found very effective, and generally, you know, they may take narcotics for 7 to 10 days, and after that, just Tylenol and Motrin, and that's usually gone by 4 to 6 weeks. This generally doesn't pose a long-term health risk to the child, and there's certainly no reason to limit their activity because they'll limit themselves. If all of a sudden this is one that's occurred a little bit later in childhood or in adolescence and they start having symptoms, I think that's a great time to come in and be seen, and we can talk about what it is and what our approach to it is. And again, what we try and do is we don't have a cookie cutter approach. It's tailored to, you know, what's going on with your child and what's the severity and is it causing symptoms and things like that.